Yeah, let me say good morning once again.
Good morning.
And to welcome you to the Ministry of Health and Social Services. The purpose of our gathering here is for Dr. Shangula, the Honorable Minister of Health and Social Services, to provide a briefing to the nation through our media on the status of the coronavirus disease in the country. We are happy that the media has turned out in big numbers, that our development cooperation partners are here, Prime Minister, to also support us in this national effort. So the media is awaiting to hear from you what you have to tell them, and through them the people of this country. Let me apologize to our guests that we are slightly delayed this morning, and also to inform them that we don't have much time in terms of engagement because of your program that is coming up at 10 and you have to leave early to prepare for your departure. But without further ado, Prime Minister, I yield to you to deliver your statement, and thereafter we'll have 10 or so minutes for questions. I thank you.
Thank you very much. Director of the program, Mr. Nangombe, the Executive Director of the Ministry of Health and Social Services. I see in front of me a lot of gadgets which have been donated to me. Thank you very much in advance for this donation. Good morning, my dear friends, WHO representative, Dr. Sagwe Moses, ED from CDC, Dr. Wirab from the NIP, and all colleagues from the ministry and our distinguished guests. I would like to thank you for responding positively to our invitation to come here so that we can update and inform the nation with the information of the topical issue that is coronavirus. Now, as a way of putting into context, following the COVID-19 outbreak, the government of Namibia undertook to provide information to the nation on a regular basis. That is to be done either through press conferences like we have today or through press release. This morning, I'm pleased to share with you the latest information on COVID-19 as it relates to your country. The outbreak, as we all know, started in Wuhan, in the Hubei province in China in January 2020. The disease is characterized by fever of more than 38 degrees Celsius, cough, and difficulty in breathing. This outbreak has now affected 104 countries around the world. As of late yesterday, the confirmed cases of coronavirus stood at 113,702 cases globally, with 4,012 deaths. In Africa, Egypt, Morocco, Tunisia, Algeria, Senegal, South Africa, Cameroon, Nigeria, and Togo have all confirmed cases, most of which is imported. Only Egypt, Algeria, and Cameroon have reported cases that are locally transmitted. Namibia continues to strengthen our preparedness to deal with the eventualities that may arise as a result of this outbreak. This includes putting in place capacities for screening and laboratory testing for suspected cases. I would like to inform the nation that in addition to screening capacity at ports of entry, the Namibia Institute of Pathology is able to carry out confirmatory tests for coronavirus. The laboratory has in fact already carried out a total of finalized 4 cases which were submitted to it as suspected cases, and there are still some specimens which are still under investigation. The capability of NIP to conduct these tests places Namibia among a few African countries that conduct such tests domestically. We highly appreciate and are encouraged by the support provided by the government of the Republic of Namibia towards the ongoing effort to strengthen our readiness. In fact, only yesterday, the head of state, His Excellency President Dr. Hage Geingob, visited Jose Kutako International Airport to familiarize himself with the setup of our screening systems and isolation facilities, as well as the military field hospital deployed at Jose Kutako International Airport. We are also enthused by the cooperation of different offices, ministries, and agencies, as well as development cooperating partners who continue to participate in our efforts to ensure readiness at all levels. Let me also deal with much of the issue which has been talked about, that is the mass repatriation of about 500 Namibians who are currently studying in China. I wish to re-emphasize that it's not advisable to repatriate such a large number of persons into the country at once. This is because such an action goes against the advice and recommendation from the World Health Organization regarding the exportation and importation of the disease into countries. The government has adopted a position that is more prudent to provide support to our citizens in China at locations where they are, instead of repatriating them en masse. This is also a measure adopted out of abundance of caution in order to avoid the risk of our people contracting infection en route or during the voyage. I must add that this does not mean that Namibians in China or in any other affected country are prohibited from traveling back home out of their own volition. Screening procedures will apply, and such persons will be advised on how to conduct themselves in line with the precautions to prevent the spread of COVID-19 and to, above all, safeguard the health of our communities and our nation at large. Any Namibian from any part of the world may travel back at any point of their choice. We call for the understanding of all Namibians, families and friends who are affected by these measures. I wish to assure the nation that our surveillance and screening measures are proving effective, as evidenced by the number of suspected cases being attended to. As of yesterday, 9 suspected cases were recorded. That's cumulative, not only in one day. 2 in Luders, 2 in Rehoboth, 4 in Windhoek, and 1 at Nanjokwe. There were also 2 cases of false alarm that were reported at Okahanja and Oranjebold. I can tell you one example of the one of Okahanja. It was an individual who apparently walked close to a Chinese who was wearing a mask. and then decided that I might have contracted coronavirus. So such, bizarre things do happen. A specimen of the 2 cases from Windhoek were sent for testing to the National Institute of Communicable Disease in South Africa. This was done privately, not through our systems. The results came out negative. 4 cases tested locally by NIP, namely those 2 from Luderis and 2 from Rehoboth. They were tested by NIP and they came out negative. There is a specimen which is currently awaited from Onanjokwe to be tested. I want also to underscore the fact that our surveillance system is working very well, and so far, according to the evidence, we do not have a confirmed case of coronavirus in Namibia. I wish to specifically advise medical personnel to ensure that diagnosis of suspected cases is done prudently and with the necessary diligence, so that only specimens from cases that meet the standard case definition of coronavirus are sent for confirmatory test to the laboratories. This will also ensure the economic utilization of resources as we strengthen our preparedness against this threat. As the WHO has cautioned, not every runny nose or cough would qualify to be regarded as a candidate for coronavirus infection. May I also caution members of the public to exercise caution and avoid spreading of sharing unsubstantiated information about suspected coronavirus cases. It is imperative that any information about suspected cases, laboratory test results, are communicated through official channels. Spreading of unconfirmed or unsubstantiated information causes unnecessary alarm among members of the public and therefore undermines the effectiveness of our interventions. The government response. The government has implemented interventions for COVID-19 preparedness. The World Health Organization has called on countries to strengthen their preparedness. The following are some of the measures that Namibia has taken. 1, to capacitate the Namibia Institute of Pathology to be able to conduct confirmatory tests locally. 2, develop standard operating procedures. And in this context, I would like to inform that there is a simulation exercise which is planned for next week. I think that will also be interesting to witness. In a case of a suspected case, how do we conduct ourselves? So the simulation will take place next week. 3, a multi-sectoral National Health Emergency Management Committee was strengthened and is now chaired by the Executive Director of the Ministry of Health and Social Services, who is today the Program Director. And this committee meets bi-weekly to deliberate on issues observed during the monitoring of the situation and then advise accordingly. 4, all 14 regions has participated in the training for COVID-19 preparedness and response. The government, in collaboration with key stakeholders, conducted a national training of trainers on COVID-19. These trainers have been deployed to the regions in order to train health workers and stakeholders for COVID-19 preparedness and response. 5. The government has procured and dispatched personal protective equipment to all 14 regions. 6. A toll-free number has been opened for members of the public to receive the necessary information on coronavirus and to communicate any queries to the relevant authority. The toll-free number is very easy to remember: 0800 100 100. 0800 100 100. And I would like to thank Ms. Hilda Namjembo, who was instrumental in securing this toll-free number. Whenever you see her, please pass our regards. Oh, yeah, okay. Oh, yeah, there she is. Yeah. Thank you very much for that initiative. The Emergency Operations Center is also functional. And we are soon in the process of appointing the incident manager for coronavirus. Now, I would like to move to the COVID-19 response as far as the SADC region is concerned. Namibia is coordinating our responses within the SADC region member states on an ongoing basis. Some of the activities include: number 1, Namibia participated in the SADC Ministers of Health Emergency COVID-19 meeting, which was held on the 9th of March in Dar es Salaam, Tanzania. This meeting recommended temporary suspension of SADC regional face-to-face meetings and encouraged the use of information communication technology such as video conferencing, webinars, and Skype calls for holding such meetings until the situation has been contained. Now, as for Namibia, all gatherings involving international participants must be conducted within the ambit of this decision. The meeting also agreed that member states establish coherent mechanism of sharing information on issues of transboundary public health concern, and that the technical committee for coordinating and monitoring the implementation of SADC Protocol on Health, comprising of directors of public health and directors of medical services, must be established. The meeting urged member states to put in place and implement COVID-19 National Preparedness and Response Plan, as well as contingency funds to address gaps in the prevention, impact mitigation, and other interventions. Our COVID-19 response plan is already in place, so we have complied already with this recommendation from the meeting of SADC ministers responsible for health. Namibia participates in the weekly conference call organized by SADC for update and support. Namibia continues to benefit from training jointly organized by CDC Africa and WHO to help countries in COVID-19 preparedness and response. As we speak, 2 of our doctors are being trained in Zambia currently on case management. The general public is still advised to adhere to the following measures as part of the prevention of coronavirus: regular hand washing with soap and water or alcohol hand rubs when hands not visibly dirty. We will continue to emphasize on this practice, as it also prevents Namibia from contracting hepatitis A. Washing of hands. And then covering mouth and nose with a disposable tissue or cloth when coughing or sneezing. Travelers with symptoms of acute respiratory infection should practice enough cough etiquette and limit contact with others. Avoid close contact with anyone showing symptoms of respiratory illness, such as coughing and sneezing, and keeping a distance of about 1 meter from that individual. Minimize or avoid public gathering. I have already mentioned earlier that we now practice that face-to-face meetings involving international participants will be either deferred or will be conducted using video conferencing facilities. Thorough cooking of meat, poultry, seafood, and eggs. And one thing which we do not do so often is drinking of as much fluid as possible, and also doing regular exercise. Not many people like to do this, unfortunately. Now, do not touch your eyes, nose, and mouth with unwashed hands if in contact with sick person or with potentially infected surface or object. Our hands are the most active parts of our body. You do everything with your hands. So I'm not saying that limit yourself, but just make sure that they are clean. That's all I'm saying. People should seek immediate treatment if infection is suspected or if symptoms occur, like severe flu-like illnesses with the recent travel history to affected countries in the past 14 days, or contact with persons from affected countries who with a person who is reported to be infected with coronavirus. Based on the current available information, the World Health Organization does not recommend any restriction of travel or trade. However, Namibian citizens are cautioned to reduce non-essential travel to affected countries. I invite the private health sector, that is doctors, nurses, pharmacists, and other health professionals, to join us in the response efforts against COVID-19. I am encouraged by citizens who took the initiative to join us and offer their service on a voluntary basis. The public sector, the public has a role to play. Join the fight. And please shy away from propagating false information on coronavirus, as I mentioned earlier, through social media and other platforms. I would like to share with you the contact number of the ministry for any inquiry with regard to coronavirus. 203-2054, 203-2054, or 203-2423, or 203-2150, 203-2150 for any information. And I would like us at all times to remember the old axiom, prevention is better than cure. Prevention is better than cure. I thank you for your attention, and Director of the program, we are ready to entertain some few questions. Thank you.
Thank you very much, Minister. Let's give him a hand for that comprehensive statement. As I said, we have about literally 10 minutes or so to pose questions.
You can just leave them here.
Yeah. Yeah. So yeah, the floor is open. Any contribution?
Yeah.
Okay. So there's a hand here. Yeah, quick one.
Identify.
You identify yourself. Where you?
I'm Shaligan from Eagle FM.
Okay.
Doctor, we wanted to know, the testing for coronavirus, is it free at public health facilities? Also, if we do have one or two confirmed cases, will hand sanitizer be given out freely? And also, some labs and health facilities, the health and lab facilities in the country, have they been notified of the standard procedure, how to handle it? And if no, why not?
Okay, the question related to the laboratory testing, I will refer it to the Chief Executive Officer of the NIP. You will hear from the horse's mouth. That is one part of your question. The second part?
The sanitizers.
Whether they will be given to who?
To the public.
To the public, to everybody.
No.
That will be unnecessary. What the public needs to do to wash hands with soap.
Yes.
And then the labs have labs and clinics, health facilities in the country. Have they been notified of the standard way to handle?
Yeah, that is the question I said. He will
just
answer.
Okay. Yeah, Dr. Ira.
Thank you, Program Director and Minister. Well, let me first of all say, in terms of whether the labs have been notified, of course, NIP has a footprint in all the regions. We have 40 labs throughout the country. We have distributed and made sure all our staff in the labs know how to handle specimens when they are brought in terms of safety, how to package it, how these specimens have to be transported to the central lab where the testing will take place. We have also, through our labs, communicated to the individual district hospitals and clinics in terms of specimen collection and how they should be packaged. Of course, the ministry itself has done the training, like the minister has said, in terms of how COVID-19 needs to be handled, but also importantly, how the collection of specimens need to take place. The important thing that I want to emphasize, that the minister also said, is worldwide, right now, there is a shortage of the reagents and testing material because everybody has gone on a panic mode. And that is the importance where if you have no contact at all with anybody who has been to a country where this disease has been confirmed, or if you yourself have not traveled, testing will not take place. We will be getting flu, as we always do. And NIB will not be testing everybody who has flu symptoms. There is a specific case definition, which I'm sure WHO and CDC colleagues will speak from a technical perspective, which the doctors need to adhere to. In terms of whether the testing to the public is free, this is a public, this is an outbreak of public health concern. The ministry has taken responsibility to make sure that whoever fulfills the case definition is offered the test. It's not a free test. Of course, somebody pays for it, but that happens behind the scenes. When a Namibian fulfills the case definition and is referred to our doors from medical personnel, testing will be done. We'll be talking about how to cover the cost.
Only Namibians?
Well, residents in the country. Yes.
Okay, yes. Yeah, yes.
Good morning, my
Yeah.
name is
Yes, you.
So I'm a from the Namibian Sun newspaper. We have the independence celebrations coming up, and I already asked the question to Mr. Nankombe yesterday. He's also responded, but I think that we are more than one person here. Some of us can probably weigh in. I mean, not us. So this is concerned that the virus's incubation period is roughly 14 days, and we do not see that people are quarantined once they arrive at the airport. There's also no guarantee that once a person arrives at the airport that such a person will in fact quarantine themselves if, say, they come from countries that are at risk. How, as a ministry, how are you looking at handling the influx of international guests for the independence celebration, and even in general, looking at other? I mean, I understand people have come from European countries, and we don't know if they've been exposed to visitors or people from Italy. So I am personally not convinced that filling in that form at the arrivals can work, because I am not convinced that all these people have been called up after 14 days. Thank you.
Okay, since you said that you posed the question to the ED yesterday and he gave the response, I asked him to give the same response so that others can hear the same. Others have heard the question, and now you can give the same response you gave yesterday.
Yeah, thank you, Minister. What I told Jemima is that all arrivals are subjected to screening on arrival, right? And they are requested, or they are required, not requested, they are required and obliged to fill in the form which indicates the recent travel of these particular individuals in order to facilitate contact tracing should it become necessary. I have also indicated, the Current Minister and our guests here, that the independence anniversary celebrations are taking place on the 21st of March. There are guests invited, and it is not practical for us to say these guests should come 14 days in advance so that we can quarantine them and then participate in the independence anniversary celebrations. What is going to happen, we are going to employ and make sure that our screening mechanisms are adhered to in order to protect the Namibian nation. So that is really what it is. But yesterday, I during that interview, Jemima and I, Dr. Zuban was present. He also gave some views with regard to this particular matter, and perhaps also Dr. Moses from WHO can chip in. Thank you.
Sure.
Repeat. Repeat what you told me yesterday.
So, Namibia is in a unique situation right now. We've had weeks and even months now to watch this virus, this new virus, and how other countries are dealing with it. We've had opportunities to learn and to better prepare ourselves. These weeks have really been a blessing for Namibia, because this time where we have had no cases in the country has been time where we can be better prepared for when that might happen here. And we know that people are worried. We know there's a lot of fears, a lot of confusion out there. This outbreak definitely deserves our attention. It deserves to be taken seriously. But we are not helpless. And you hear Ministry of Health speaking about preparing for when cases come, because they understand that there's nothing magical protecting Namibia different from any other country. They want to be prepared. We all want to be prepared for when cases could arrive here. And when they do, we want to be able to say, this is what we prepared for. So there are a lot of elements to that. CDC is happy that we are able to support the ports of entry, the case management, the critical care, the contact tracing, the laboratory, the logistics, to be here to support. We've been here since 2002, and we are proud to be able to support during this crisis, and we will be here through the end. In regards to specific ministry decisions on independence or on travelers coming here in general, That is, of course, the government of Namibia's prerogative. We want that information to be very clear to everyone. We want travelers coming here, whether it's for independence or otherwise, to really understand what Namibia's position is, what they should be doing. Namibia has been very clear not to travel here if you are sick, but if you are coming from an affected country, that you will be screened and you need to monitor yourself for symptoms. So I think it is important for government to do everything possible for all visitors arriving every day from affected countries to know this and to have the right information. And it's good that we are gathering their contact information when they arrive so they can be traced as well. Anything more strict than that in terms of actually restricting travel from countries or changing Independence Day celebrations would of course be something that government would take up at the highest level. But while they are doing all these preparations, I also want the people in Namibia to know that they have a role to play. They can be preparing themselves as well, using these days where we don't have infections yet to be altering or adjusting our personal practices so we can be best prepared to protect our own families, right? You heard them already, washing our hands frequently, trying to touch our faces less, coughing into our elbows or into a tissue, getting our flu shots is another one. A flu shot will not protect you from the coronavirus, but it protects you from a disease that looks very similar. And this will also help the nation and help the health of your family. And I think just to finish, staying informed, we know that guidance will change. Every day we are learning more about this virus around the world. Every day the situation is a little different in Africa, and the situation may become different here in Namibia. So people need to stay informed, understand the latest guidance, and we're happy that the ministry is a great partner in that.
Thank you very much, Dr. Charles. I was going to give you a chance to speak after the questions, but can you chip in here with respect to the question from Jemima?
Okay, thank you. Thank you very much, Honorable Minister and ED. The issue of coronavirus, I believe that is of a major concern to everyone, and that the concerns expressed by Jemima is a reflection of that of the ordinary person in the streets. And I also believe that the ministry takes this very seriously, and that is why they have put in place the measures that we know of. As WHO, we have been working very closely with the ministry in all these areas, ensuring that the right information gets to the technical people as well as the ordinary citizens. We send out the global information of what is happening, and then we support the dissemination of information in country. I believe that some of you may have seen on the TV the adverts of how to protect yourself last night. So these are part of the work we are doing together with the ministry. We have also supported in areas of the lab, in terms of the reagents, supported in training of health workers. We have supported in other equipment, and we continue to work within the plans that the ministry has put in place. And the purpose of this plan basically are to contain the virus should it come here. And the best way to do that is to prepare. And as the earlier speakers have said, preparing yourself. So preparing as a nation also involves preparing as individuals and our attitudes and practices. Now, when it comes to how are we going to handle the first case, because it's very, very unlikely that we have a bus load or a plane load of people who are positive. How we handle that first case is the crucial thing, and that is the kind of preparation that the ministry is putting in place to ensure that if we get a case, first we need to be able to detect what the cases are. Because if you are fighting an enemy and you don't know who the enemy is, and you don't know how to identify the enemy, you cannot win the battle. And so first thing is detecting, and that is why we commend the Honorable Minister and the NIP for now being able to test in country. It shortens the time between the time of suspecting and the time of confirmation. So we know what we are dealing with. It's very important, especially now that we will soon enter into the seasonal flu the season, where we'll be getting ordinary flus as we get in almost every winter. So that is a very important step. So we know how to identify the first case. And then we have put in place isolation measures, and you saw the isolation that we inspected at the airport and also in the hospitals, so that we also protect the health workers. Because if a health worker gets infected, the health worker is also attending to other patients. So you find that you go to the hospital maybe with anything. You go with a broken leg, and then you end up with a broken leg plus the infection. And that is what we want to avoid. So we are ensuring that the health worker is protected, and also communities, so that we engage with the community to ensure that within the community there's vigilance. The community is vigilant enough to pick any case, and also to support someone in the community. Remember that the most vulnerable people need extra protection. And we know that in this outbreak, they are mainly the elderly and people with underlying health conditions. Now, specifically about what to do when people come in, I think the measures that have been put in place at the airport to ensure that when they come in, they are screened. It's one of the sensitive ways of detecting. As I mentioned, unless you're able to detect. Now, you detect that someone has a temperature, has a history that fits into the case definition. What do? Then the person is isolated. So the question really is, are we prepared to deal with an influx of people? And how do we handle them? And I believe that is why the ministry is putting in place the isolation center there, also in other facilities in the country, and also trying to get involved the private sector, so that almost in every health facility we have the means of dealing with those who may need to be isolated. As I mentioned, once we are able to take care of the few who may be positive, then we can contain the spread. Otherwise, there's no chance. And I believe that these measures are addressing the concern that Jemima raised.
Yeah, we are running out of time, but I just wanted to, two more very quickly. I just wanted to add to the question which was posed, that the number of delegates who are coming to witness is not much more than the number we are receiving every day at the airport. Every day the airport is busy with people arriving from all over the country. So even those ones, the few ones who are going to come to the independence celebration, they will be treated in the same manner. So they should not be worried that it's now something, coming to overwhelm Namibia. Yes, there was another hand there first.
Yeah, yes, sir.
Just briefly.
Yes, briefly, yes.
Very short. Good morning, Comrade Minister and my colleagues. My name is Samuel from the Information. I just wanted to share a question actually, because we are sharing this with nearly 1 million people on our social media, and there seems to be a little panic mode about the 9 suspected cases. Maybe, I know you have stated this, maybe can you just reassure them that if they were tested positive or negative? Because they are asking questions here and everybody's panicking. I know you have mentioned it, maybe if you can just reassure them. You're watching live right now.
Yeah, it is there in my statement that all the cases which were suspected and tested so far, whether at NIP or in South Africa, they are all negative. Yeah.
Yes, okay. One last one here.
Two.
Okay.
Yeah.
2, okay. Yes, ma'am.
Hi, Henriette, Republican. I just quickly want to know, we visited the field hospital yesterday. Personnel for this isolation ward and field hospital, will they be on standby? How will it work? Will you appoint specific doctors, nurses that will be stationed here at the airport? How will that work?
Since my questions are almost ready, I can just add. Okay. I'm Danki from the Namibian newspaper. I just want to ask, when do we expect this hospital to be fully equipped with staff and nurses? And
Which hospital?
The one at the airport.
Okay.
The field hospital. And then, and also the tests, since we are one of the few African countries who are able to carry out the tests, and we always have this sort of equipment, where do we get them from if we have them now? And then also the Chinese that are operating in Namibia. We had some who were working at Chinatown and then some who were working at the acupuncture department at Kantra Hospital. What exactly is being done to make sure that, I mean, I understand they are under self-quarantine of sorts, but is there anything that is being done to ensure that they are not also becoming victims of abuse or xenophobia from the public?
Okay. The first question related to the field hospital. The field hospital is there. You have also seen the isolation. Yeah. So the two, they work together. Now, if we get a suspected case for isolation, we fill up first the 4 beds, which are 4, and then if there is a spillover, then we put them in the field hospital. It's not really meant for treatment. That is meant for isolation. It's a quarantine. If there is a full-blown case, that full-blown case will be brought to town for treatment. Yeah. Now, concerning the Chinese who went into self-isolation, you see, if you follow the timeline, by this time they have already exceeded 14 days. And then there has not been a case of them recorded as having coronavirus. Now, the other thing which we should try to avoid is to label, people from different countries. I can tell you that in Africa, the cases of coronavirus which we have in Africa did not originate from China, but it originated from Europe. So it doesn't mean that whenever you see a Chinese, then you say, oh, this is a potential coronavirus something. No, we shouldn't label people like that. Yeah, but I can assure you that those who were here, who came here, they are already over the incubation period. Yeah.
Okay, as I indicated, unfortunately the minister has another engagement. I am constrained to end our engagement at this particular point in time. It's a pity that not everybody who wanted to ask a question has been given that opportunity, but it's really because duty calls elsewhere and we need to release the minister. So may you please allow me to declare the meeting adjourned. Thank you very much.
We'll call you again if there is something. Yeah. Thank you.